At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. And it's a kind of a gloomy day, but I'm going to try to be happy so sunshine begins to break through the clouds. Maybe if we all focus on that, it's that stupid hurricane that came up. What a devastating situation. I'm so sorry for so many different people. You know, this is kind of queer weather, but it is what it is. So we'll just have to do what we can to help as many people as we can, because some people are really in a really bad place because of it. So if you can, reach out. Do the best you can, and always, you know, if you don't have anything else, pray, and perhaps they'll be able to glean a lot from just that gesture. Got a program for you today that we want to continue on kind of the subject that we've been, tipping into over the last few weeks, and it's called brain concussion, or TBI, traumatic brain injury, and due to concussive patterns. But what you don't understand, and what I've observed over a period of many years, is that concussions can come from something other than what we think is a concussive force. Now, what do I mean by that? We know that if you get hit in the head by anything, a punch, a fall, a blow, a trauma, playing sports, hitting your head on the trunk of the car, that can be a concussive force that can disrupt a lot of things. And then they're worried about swelling, they're worried about brain bleeds, they're worried about cognitive dysfunction and so forth. But it actually goes deeper than that. And there are other types of concussive forces that we've touched upon a little bit, but I want to bring out, and I want to show you what takes place. So let's take the platform that these things are real, that all these blows and traumas and so forth are there. Remember, I've said over time that the bone, the body, the neurology system remembers injury, remembers traumatic injury or minor injury until it's fully and completely and totally resolved. And it's not just the inflammation that decreases over a period of time that signals and indicates that it's resolved. It's in fact another neurological pathway, a recording, if you will, of what takes place. So let's get into what we're talking about today, but I want you to kind of listen to what I'm saying very carefully, because normal, traditional, unless you research it deeply, medical science is not going to talk about it. Everybody talks about concussion. Everybody talks about, oh my God, they're going to have a brain bleed. They're discoordinated. They lose their cognitive sense. They go into aphasic patterns and so forth. But what happens when we have a subtle trauma, a blow, and I'm going to give you some other ones that will cause that affects something called your neuroendocrine system that triggers from the brain. What do I mean by the neuroendocrine system? What I'm talking about are all of those other hormones, if you will, that are secreted or at least initiated by the brain, particularly in an area of the hypothalamus, but more importantly, the pituitary gland. And we know that that pituitary gland signals a lot of do this, do that type of signaling, to put it in that type of vernacular. But what I want you to get is that unless the skull, and with the embedded memory of the injury, is really resolved and taken care of, this ongoing aberration, this inhibition of the signaling process gets disrupted, and sometimes permanently, and sometimes it shows up years later, even up to 5, 6, 10 years or more later on. So let's kind of pick that apart, and let me tell you why I'm telling you this. Well, after 48 years almost in practice, I've observed many different situations that a lot of other practitioners scratch their head over, and I did too early on in stage. But when you take a look at how the skull, that hard component, that hard head of ours, protects the brain, it gives you a clue that unless certain things are dealt with, that you could have a long-term effect. So here's what we're talking about. Your head is made up of 22 bones. And each one of these bones have these little sawtooth interdigitations, if you heard me said before. And when you breathe in and you breathe out, they expand slightly and they come back together. And underneath these bones, you have a heavy fascia. It's almost like a heavy plastic wrap. It attaches a few places in that skull. So it tugs on it. It pushes spinal fluid, but also pushes hormones down the spinal fluid and so forth. But there's other secretors. There's other guys that, because of that rhythmic pattern, work the way they're supposed to. And sometimes when those joints, those little sawteeth interdigitations are locked, they're jammed because of injury, they don't work the way they're supposed to. Now, when we go into the live stream program today, I'm going to talk a little bit more about this, and I hope you'll join me. I want you to make sure that you go into drtomroselle.com. You can click that, and it'll take you right in the live stream. Also, you can do it very simply, and I want to remind you, follow me on all of the different platforms that we're on, everything from YouTube to Facebook to Instagram to you name it, we're there. I mean, Twitter and LinkedIn and Twitch and Player, and then you're going to see one called Restream. You can find that by going to drtomroselle.com, but you can do that today, but follow me, because as soon as you do that, we'll let you know when these programs go live, but this one will go live immediately after this. So let's get back and talking about what this problem can produce. And we'll start with, how about menopause, ladies? Guys, how about andropause? And you're sitting there, how in the heck can a traumatic brain injury or something that causes a joint space locking of these 22 different bones in your skin cause that to take place? I'm going to tell you about that, and we're going to go into and we're going to the live stream. We're going to talk about what happens when you sneeze and you hold your breath. Does that cause a brain injury? Well, I'm here to tell you it is, and I'll tell you how that takes place later on, and it can cause other dysfunction as well. But these neuroendocrine disorders after traumatic brain injury are significant, and they're real. Significant changes take place in this pituitary director, this little gland in the middle of your head that produces a lot of different hormones. 80% of patients that show evidence of endocrine dysfunction in the ovaries and the testicles and so forth can be a result of traumatic brain injury. 18% show growth hormone deficiencies. So you get a little child that bumps their head. Now you can't, put a football helmet around these kids, but significant traumas and injury and so forth, they can cause a problem. 40% of patients demonstrating something called vasopressin abnormalities that leads to things called diabetes, and particularly diabetes insipidus. It's a syndrome that, if you will, of inappropriate antidiuresis, and that means that you kind of don't have good filtering systems for fluids within your body. That's a whole different story we can get into a little bit later. But if you go to an article, me in my articles, right? I'm always into these areas and reading and trying to bring you the best information. There was an article that was written in the Journal of Neurology and Neurosurgery and Psychiatry. There's a host of guys. There was 4 of them actually that were primary authors in it, and it was done at the Academic Department of Endocrinology in a hospital called Beaumont Hospital and Medical School in Dublin, Ireland, of all places in the world. And I'm reading to you directly from it. This goes back to 2007. And it went on to say that TBIs, or traumatic brain injury, is the most common cause of death and disability in young adults living in industrialized country. That's us, folks. That's us. And they're talking about 180 to about, their estimate was up to 250 people per year die or are hospitalized as a result of a blow to the head of some sort. It doesn't have to be significant, it can be minor, but it builds up over time. But neuroendocrine, neurological endocrine means organ systems, abnormalities after traumatic brain injuries have been looked at now potentially more and more over the last several years, and they contribute to things not working the way they're supposed to, and morbidity, I don't feel really good, and mortality, actually death, and after trauma. And they're talking about 80%, 80% is a big number of patients that have been hit in the head or have had injury to the head or have had pressure in the head or have had concussive forces to the head are showing evidence of gonadal problems. So let's roll it back in and kind of finger point it. That means hormonal dysfunction. That means that, ladies, you go through early menopause, or you go through a bad menopause, or you go through premenopausal craziness, the ups and downs, the night sweats, the chills, the emotional reactions, all of those things that start building up over a period of time. And what they began to see is that these hormonal dysregulations are real. And where they didn't know where they were coming from before, now they're seeing a finger pointing that relates to concussive patterns. So think about it over time. If you've ever had a problem where you've had a blow to the head, you've had trauma, you've had irritation of any kind, maybe minor, maybe it came from this. Maybe they said you're okay, you didn't have a bleed. Maybe they said, oh, you'll grow out of it. Maybe that dyscognitive pattern where you don't understand, your word searching, you're having problems with that, is a result of post-traumatic problems. Now, we got a class that's coming up, as you all know, that, if you pay attention to what we're talking about. But on Wednesday, October the 9th, coming up a week from this coming Wednesday, as a date, 6 p.m. at the Roselle Center for Healing in Fairfax, we're going to be doing a class on head trauma and concussion. But what I want you to understand is that we're going to start covering some of these other things that you may not have thought about. And where is that hormonal dysregulation coming from? Guys, where's that ED coming from? That erectile dysfunction that should not be there. Or a young man in his 30s, after having played sports over a period of time, all of a sudden the body isn't working the way it's supposed to. Or there's a major shift in signaling in the body that has to do with hormonal, not just the long-term effects of memory and, even confusion, and as you go on, progressive dementia and the like. Here's the deal. If you know that it's triggered by something like this, and in my world, we know that there's a way of reorganizing the communication pieces and normalizing the normal motion, if you will, of the skull bones, then you can get that back. So when we start looking at how the body actually works and what the real situations are behind it, and when there's tons of articles out there that are finger pointing that most of your doctors don't even know have been written, because they're not doing the stupid stuff that I do and go out and, look at all the stuff. But even the National Center for Biological Information, which is out of NIH, right? They've been looking at this now for quite some time as well. Remember I said that's one of the major places you want to go to read things? There was an article there that they were talking about, said endocrine dysfunction. That means, your thyroid and your pituitary and your adrenal glands and your ovaries and your gonads and your testicles and so forth. They're talking about endocrine dysfunction after TBI, or traumatic brain injury. And the subtitles, an ignored clinical syndrome. An ignored clinical syndrome. That means that people aren't putting the pieces of the puzzle together. They're not looking at brain injury and how it affects pituitary dysfunction, or they're not looking at pituitary and adrenal dysfunction. They're not looking at that whole situation they think it's coming from there, but the question they're not answering is, why is it there to begin with? Well, that's my job. That's, I'm the guy that's going to continue finger point and be the irritation to tons and tons of people, but make you smarter than most of your docs. And that's what we want you to do. But we've been looking at this for a long time. So when we deal with this, when we deal with somebody who has not only cognitive impairment, or suddenly they end up with, a heart fibrillation, we're looking at the skull. We're looking at the head. We're looking at these 22 bones. We're asking questions about injury. We know that in children, the incidence of hormonal dysfunction peaks somewhere between ages of 7 and 11, about 2 years after they've had any kind of injury patterns as well. Interesting, right? Now, here's the situation. The risk of this pituitary dysfunction after a pediatric traumatic brain injury has been noted to be higher in females. And it peaks at an early age. And why is that happening? Because, think about it, girls go into growth spurts and they go into hormonal development faster than boys do. So that's one of the reasons that it's there. And there's a lot of triggering. We won't get into it in the program today, but that's part of the reason. So the pituitary, there's this thing that you've heard me talk about repetitively. It's called HPA axis, hypothalamus pituitary adrenal axis. And it forms the spine, if you will, the backbone of the endocrine system. But it's, it's dependent on structural pieces and so forth. It's responsible for balance in the communication of all the hormonal platforms. Look, the injury of a traumatic brain injury can cause direct damage to the hypothalamus. And that lower piece is called a pituitary stalk, is right next to it, or the pituitary. So if any of those guys aren't working the way they're supposed to, you end up with major disruption of hormonal balance in your body. And you go through ugliness. You go through problems with menopause, and guys with, andropause and ED and all of those pieces of the puzzle. So if that's the case, and I'm indicating that something can be done about it, wouldn't you like to find out? Well, you can have that opportunity coming up pretty quickly at the Roselle Center for Healing on the 9th of October, a week from this Wednesday evening at 6 p.m. Join me. Listen, we'd like you to register for that. So if you go into rosellcare.com, you also can go to drtomroselle.com, but rosellcare.com, you scroll down just a little bit, you're going to see healthcare class, and it's called Long-Term Effects of Head Trauma and Concussion. This is one of the things that we're talking about. The long-term effect of head trauma concussions can be subtle and significant. It's not just a headache, although you can have a headache. It's not just blurry vision, although you can lose your eyesight. It's not just, I can't hear anymore, word finding problems or things of that nature. It can be the hormonal balance in your body where you don't give a hoot about anything anymore. You have no, you have nothing that you want to look forward to. There's no dopamine surge, which is your I want to do hormone. So join me, and I promise I'll get into it. And as always, we're going to tag team this thing, and we're going to have some fun doing it, but we'll stay here as long as we need to. We'll give you all the information that you should have, and teach you how to ask the right questions. That's why we do the program. That's the primary reason that I'm here, is to give you the information simply because you deserve it. And you need to make sure that you get it. By the way, what I'd like you to do is go into the website as well, but register for the class, call us up, register online, or you can call the office, 703-698-7117. And the only thing I ask you to do, as always, register. But if you can't make it, please let us know you can't make it. Call us the night before, the morning of, and then so if we have people on a waiting list, we can call them and say, hey, why don't you join us? Okay. This is our gift to you as a community, because it's our responsibility to teach you. It's our responsibility to give you the information. So October the 9th, make sure you join us at the Roselle Center for Healing, Fairfax, Virginia. We're right off the National Capital Beltway. It's really easy to get here. You're on, it's Arlington Boulevard, which is Route 50. You're about a third of a mile off. and you turn the corner, we're right there. So it's easy to get to. I promise you, this will be a night that many people up until now, until my big mouth starts telling you the information, really didn't think it through. And particularly some of our physicians, they don't understand it. How many of you go to a doctor complaining that you have a hormonal dysfunction? You know, your menopause is going crazy. You've got these hot flashes. You're reactive, and just for little things. And you normally wouldn't do that before. This could be the whole thing, because way back in the day, something happened to you, or you have a bad habit of holding your breath and sneezing. What happens with that? Just the same thing as a trauma, but it's from the inside out instead of from the outside in. Remember what I said, sneezing, if you hold your breath when you're sneezing and push that sneeze down so nobody can hear it or you're not embarrassed, can have the effect of accumulation, causing head trauma and all kinds of things that nobody seems to know what to do with. So what I would suggest to you is please join me, and I promise we'll go into the depths of what happens, but more importantly, what you can do about it. It's important. We have to make sure that you get it and that we have the opportunity to reverse it for yourself. So join me just in a couple minutes. We're going to go to live stream. It's called Ageless Health live stream with Dr. Tom Roselle. Go to drtomroselle.com, click there, or if you're already following me, which I hope you are, we'll let you know, but do it now. It's always there. You can go back and re-listen to all of our live stream opportunities. Next week, by the way, I'm going to have a special guest with me, Dr. Evan Mladenoff, and we're going to be talking about concussion. He just released a new book, and it's called When Can My Child Go Back to Play? And it has to do with us as well. But he's an amazing, amazing doctor. Was the doctor for the Kansas City Chiefs for 13 years. And we're going to go back and forth. I've known this amazing doctor for years. He's an incredibly brilliant man. We're coming up to the end. Don't forget, immediately, let's go into the live stream together, and I'll continue this. And you get to see the face on the live stream program. Remember, I do this every Sunday for one reason only. I love you all. I'll see you in a couple minutes.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.